Hello, my name is Georgia Rourke. I am a 7th semester nursing student. Today is October 26th of 2020 and it is 10:15 in the morning. And today I will be doing my insulin checkoff with an insulin pen as well as mixing insulin vials. So beforehand, I want to make sure that I know my patient's glucose, blood glucose level, so that I'm not giving insulin if I don't need to. I also want to make sure that I'm giving the right type of insulin and it's the right patient. So I'm going to go ahead and get started. Hello, my name is Georgia. I'm going to be your nurse today. How are you doing? Can you tell me your name and date of birth? Perfect. I'd go ahead and tell my patient that I'm here to give their insulin. So I'm going to go ahead and I'd locate my insulin pen, make sure that it's the right type of insulin. I'll go ahead and get my gloves on. Okay, I'm going to roll my insulin pen about 10 to 15 times. And I'm going to clean the top of it before I put the needle on. Okay, I'm going to go ahead and put my needle on. And I'm going to prime it 2 units before I get my actual dose. Sure this is all good. Okay, I'm going to go ahead and prime it for 2 units. And then I'm going to go ahead and get my patient's dose ready. So say my patient's getting 10 units. I'm going to go ahead and put the cap back on until I'm ready to administer it. Now I'm going to go ahead and clean the site. I would ask my patient if they had a preference on which site. I'm going to give it in the abdomen. So I'm going to clean the site really good and let it air dry, not blow or fan it. And then I would go ahead and tell my patient, I might feel a little bit of a sting. I'm going to pinch the skin. And then I'm going to go ahead and go in and tell my patient 1, 2, 3. I'm going to push until it clicks all the way. I'm going to wait and then I'm going to pull it out. And then I'm going to recap it and then I'm going to demonstrate mixing vials. Let me clean this up. I'd go ahead and get rid of the needle. Capped. And then I would keep the pen for the next time. Okay, so next I'm going to be mixing vials. So I have clear and cloudy, and I want to make sure that I know that I'm going to draw up my clear first. So I'm going to go ahead and clean the top of my clear one. And then I'm going to take and pull back the amount of units I'm going to do. So say for my clear, I'm going to do 10. Take my cap off. I'm going to go straight in and insert my air. And then I'm going to pull back the amount of insulin that I need. And then I'm going to recap it. Okay, I'm going to set that one aside. And I'm going to go ahead and clean my cloudy one. First, I want to roll this cloudy one 10 to 15 times, make sure it's mixed good. And I'd also have a nurse check the amount of insulin while the needle was still in the vial. So I'm going to clean this really good. And then I'd pull back the amount. So say I'm giving 5 units of that one. I'm going to go ahead and insert it completely. Insert my air, probably before I tip it over. And draw back my 5. making sure I don't mix them. And then I'm going to cap it, make sure I have the 15 units that I need. And I'm going to go ahead and clean my patient's site like I would when I'm doing the pen. And let that air dry. And then I'm going to go ahead and do the same thing I did for the pen. And I'm going to give it in the abdomen and make sure I rotate sites whenever I administer the insulin so I don't give it in the same spot every time. And I tell my patient they're going to have a little bit of a pinch, and I'm going to stick it in 30 to 90 degree angle and go all the way till it clicks. And then I'm going to immediately take this and cap it. Take my needle and cap it. And I would dispose of it in the sharps. And then I would make sure my patient didn't need anything else. Make sure he was comfortable before I left the room. And then I would go document the time I gave it, what type of insulin I gave, and how my patient tolerated it.